Hypertension, or high blood pressure, is a major cause of premature death worldwide. It can give rise to several health issues, including heart disease and stroke. If you have high blood pressure, you probably already know that eating a balanced diet is one of the best strategies to control it. You should also avoid foods that can increase your blood pressure. In this video, we are going to talk about the top 7 worst foods for high blood pressure along with ideas for healthy alternatives. Be sure to watch until the end, because there is one food that almost everyone consumes far too often. So if you are ready, let's get right into it. Number 7. Salt. High blood pressure and heart disease are both linked to salt, or specifically, the sodium in salt. When you consume too much sodium-containing salt, your body stores more water to flush the salt out of your system. This may cause blood pressure to rise, and the extra water puts your heart and blood vessels under strain. The American Heart Association recommends that you consume no more than 2,300 milligrams of sodium per day, or about 1 teaspoon of salt. Unfortunately, the bulk of sodium in the American diet comes from processed foods rather than what you add at the table. Number 6. Deli meats. Deli and lunch meats are often packed with sodium. That's because salt is used to cure, season, and preserve these foods. Just 2 slices of bologna contain 910 milligrams of salt, according to the U.S. Department of Agriculture database. 1 hot dog has 567 milligrams of sodium. Adding other high-salt items, such as cheese, bread, and pickles, mean that a sandwich can become loaded with sodium very easily. Number 5. Sugar. Sugar can raise blood pressure in several ways. Sugar, especially sugar-sweetened beverages, has been linked to weight increase in both adults and children, according to research. Being overweight predisposes people to high blood pressure. According to a 2014 study, added sugar may also have a direct effect on raising blood pressure. One study in women with high blood pressure reported that cutting sugar by 2.3 teaspoons can lower systolic blood pressure by 8.4 millimeters of mercury, and diastolic blood pressure by 3.7 millimeters of mercury. Number 4. Frozen pizzas. Frozen pizzas have high sugar, saturated fat, and sodium content due to the combination of components. Cheese is notoriously rich in sodium, with 2 slices of American cheese containing 512 milligrams. Manufacturers often add a lot of salt to maintain the flavor of the pizza after it's been baked. One frozen 12-inch pepperoni pizza contains 3,140 milligrams of salt, which is significantly above the daily limit of 2,300 milligrams. As an alternative, try making a healthy pizza at home using low-sodium cheese, handmade dough, and your favorite vegetables as toppings. Number 3. Alcohol. If you have high blood pressure, your doctor may advise you to cut back on the amount of alcohol you consume. Alcohol can interfere with the effectiveness of any blood pressure drugs you're taking due to drug interactions. Furthermore, many alcoholic beverages include a lot of sugar and calories. Alcohol consumption can lead to weight gain and obesity, which can raise the risk of hypertension. Heavy drinkers who cut back to moderate drinking can reduce their systolic pressure by about 5.5 millimeters of mercury and diastolic pressure by about 4 millimeters of mercury. Number 2. Canned soups and tomato products. Canned soups are easy to prepare, especially when you're short on time or not feeling well. However, they are high in sodium. A can of tomato soup has 1,110 milligrams of sodium in it, whereas a can of chicken and vegetable soup has 2,140 milligrams. Instead, go for low or reduced sodium soups, or make your own from home with fresh ingredients. Most canned tomato sauces and tomato juices are also high in sodium. As an alternative, choose fresh tomatoes, which are high in an antioxidant called lycopene, to lower your blood pressure. Fresh vegetables have numerous heart health benefits as well. Number 1. Processed foods with trans or saturated fats. People should avoid trans fats and reduce saturated fats to maintain their heart health. This is especially true for people with hypertension. Trans fats are artificial fats that extend the shelf life and stability of packaged foods. However, they also raise your bad LDL cholesterol, while lowering your good HDL cholesterol, thus increasing your risk of hypertension. Saturated fats also increase LDL cholesterol levels. Saturated fats are mostly found in animal products including butter, chicken skin, full-fat milk, and red meat. Next, what are the best diets for high blood pressure? Eating a heart-healthy diet can actively lower your blood pressure, both in the long term and short term. Potassium-rich foods can quickly lower blood pressure because potassium counteracts the effects of sodium. Nitrate-rich foods, such as beets and pomegranate juice, can help lower blood pressure too. The DASH diet is recommended by the American Heart Association to help manage blood pressure. DASH stands for Dietary Approaches to Stop Hypertension. This diet involves eating plenty of vegetables, fruits, whole grains, and lean protein to help maintain healthy blood pressure levels. There you have it, top 7 worst foods for high blood pressure and healthy alternatives. If you enjoyed the video, please hit the like button and subscribe to our channel for more videos. And as always, thanks for watching.